Hey, this is Dr. Matthew Jurgis here with Move to Improve. That's right, we rebranded the podcast from Proactive Podcast to Move to Improve. It sounds better, it makes sense, it's a jingle, it feels right, and we hope you guys like it and can kind of, follow along with that. So, today we have Dr. Mandy Swinden here with us.
Hello.
Hi. She is a naturopathic doctor and she specializes in female hormones and sports performance. Is that fair enough?
Yeah, I would describe it that way. I'm not technically allowed to use the term specialized, but I focus in female hormones and performance. Not necessarily just sport performance, I would say just performance in general. There's a lot of overlap when it comes to the physiology of brain and muscles. So when we work on athletic performance, often there's some brain performance that happens as well.
Yes, there is. It's a very important part of performance that can get easily overlooked.
Exactly.
Right? And so I'm really excited to have you on because I think probably the two coolest systems in the body has got to be the neurological system.
Well, your opinion on that is biased
And
as a chiropractor.
It's very biased, right? But come on, it's so cool. And the endocrine system.
Yes.
Right? The endocrine. I don't know. I think when I learned about the endocrine system and you hear all these hormones and then you kind of start to attribute personality to them and they're so dynamic and there's just so much depth to them. And they have all these cool little functions.
They do. Yeah.
No wonder your interest lies there.
Yes, hormones are cool and they have a lot of control over us. So sometimes when things are happening, it's not necessarily us that's doing it, it's our hormones. And that's especially the case for females as our hormones fluctuate in a different pattern compared to males. It's not better or worse, it's just different.
Okay. I wish I knew that in all my past relationships.
Yeah. Actually, there's a lot of good things to know about female physiology and that even females don't even know about themselves. So I'm on a mission to educate as many people as I can.
Really? Okay. I feel like I'm going to learn a lot today. This
Yes.
is interesting. All right. So where do we start when it comes to female hormones and how that ties into athletic performance?
I would start with just defining the 4 phases of the menstrual cycle. So for females, our hormones cycle on a monthly rhythm. Females of reproductive age, I should say. So children and postmenopausal women, those women have the same hormone cycles as a man would, as a male would.
Sorry, one more time. Postmenopausal women?
Postmenopausal women and children. So
Okay.
Just females of reproductive age have what's called an infradian rhythm. So I'm sure most of us have heard of a circadian rhythm.
Yes.
And so just for the listeners, a circadian rhythm is our hormones that cycle over 24 hours. So animals will have circadian rhythms as well. But then females of reproductive age have an infradian rhythm, and that, by definition, an infradian rhythm is just a rhythm that's longer than 24 hours.
Really? Mm-hmm. And just curious, is there any other infradian rhythms within men? Does it exist outside of the menstrual cycle or that cycle?
So men's hormones cycle on 24 hours, so they will get a boost of testosterone in the morning.
Mm-hmm.
Most of their growth hormone is secreted like 10-11 p.m. So like the early evening, and that continues. So for a male, basically our whole society is set up for males. So we cycle on 24 hours. Like our work schedule is based on a 24-hour rhythm.
Yeah.
And for females of reproductive age, we have that 24-hour rhythm but we also have this infradian rhythm that is over a month. And so some tasks are better for us to schedule in a certain week of the month versus doing them every single day.
Okay, so before we get into how that would apply to a month, what about in a day? So you're saying that at least for men, testosterone spikes in the morning or growth hormone in the evening. Maybe it's similar for women. Is there any added value in doing a morning workout, let's say? It is.
Yes, yeah, if you want to sort of ride that testosterone wave. So you hear about all these like biohackers doing 5,000 things before like 5 a.m. I'm exaggerating, but like you understand what I'm saying. And that works really well for males because of the state of their hormones.
Wow.
And it can work for women at certain times of their cycle, but then other times it just doesn't. And if we continue to try to do like force ourselves to do that day in and day out, we end up with hormone imbalances.
Okay, so try to do like exercise try to do what day in, day out?
So if you have like a morning routine, so this again, like going back to biohackers, not to like rag on them by any means, like a lot of what they do is really beneficial for males, but not so beneficial for females.
Okay.
But doing like, yes, a high intensity workout first thing in the morning fasted, great for males, not so good for females.
Okay.
Doing a fasted workout might be okay during the menstrual phase of a female's hormone cycle, and maybe the follicular phase, maybe the ovulatory phase, luteal phase, bad idea.
That's really interesting. Very weird. So
Not weird.
I mean, not weird. No, not weird. But it's just weird. You never would have thought that. So I gotta ask. So working out fasted, I there may be a value to that in terms of like a calorie deficit type value. But if I work out fasted, I know I'm going to be performing less, or working out first thing in the morning. I like just don't have that. Your nervous system maybe isn't in full spin. Is there any setbacks associated with that?
With doing a fasted workout?
Fasted workout, yeah.
It can be catabolic. So being in a fasted state, what male hormones do and what female hormones do is vastly different. So there is a decent amount of research on fasting in like different ways, like 16 and 8 or multiple day fast. So there's like shorter ones and longer ones. I think 16 and 8 is the most common. And lots of beneficial things happen to males. So like their growth hormone will increase, for example. But for females, our cortisol increases. And it really puts our body in this super stress state, because if you think about female physiology, our body's goal is to conceive life. If we're fasted, it sets off this signal like, we can't make a baby, like flash the red lights and let's like hold on to every single calorie that's consumed, so that we can utilize it and like maybe make a baby if we can. But the biggest thing is like usually women, if they do that for long periods of time, like continually intermittent fast, or even like multiple day fast, they will stop ovulating and maybe even become amenorrheic, so lose their periods. And that's not a good thing.
It's not good.
No.
And is that kind of like nature's way of being like, this person probably isn't suited to have a baby because they're not having nutrition, they're not having
there's not enough fuel to build a life.
For sure. For sure. Wow.
Yeah.
Wow.
Yeah, so it doesn't mean that we can't ever experiment with intermittent fasting or even longer day fast. We just need to know when in our cycle it's appropriate to do that. And so if we look at how the hormones fluctuate over a month, the menstrual, I'll just define the 4 phases quickly so that when I'm using these terms, people know what I'm talking about. So the monthly cycle, the infradian rhythm, as I referred to it before, can be broken down into 4 phases. So the menstrual phase, which is during the bleed, so when a female is actually on her period, that's the menstrual phase, typically defined as phase 1. The follicular phase is from when bleeding has stopped to right before ovulation. And then the ovulatory phase is the shortest phase. It's only like 48 hours, and that is the release of the egg from the ovary. And then after ovulation to the day before the next bleed is the luteal phase, which is the longest phase. And so if we look at those 4 phases from a hormone perspective, our hormones are at the lowest level, and we're most similar to a male physiologically in the menstrual phase. And then as we move into the follicular phase, estrogen starts to build. Ovulation is like a spike in hormones. So we have luteinizing hormone, we have follicular stimulating hormone, estrogen spikes, testosterone spikes during ovulation, and then those hormones will drop a little bit after ovulation, and then progesterone is the dominant hormone of the luteal phase. Estrogen is also decently high in the luteal phase, but progesterone is higher. So sometimes the luteal phase is referred to as the high hormone phase, and that will typically be where most females notice like they have mood issues or cravings or just generally don't feel as good. And it doesn't need to be like that, but there's a lot of things in our environment that that affect our hormones and lead to imbalances and are contributing to those crappy feelings in that time. So then as we move into like from the luteal phase into the menstrual phase again, because this is a cycle, those high hormones will drop, and how quickly they drop or how suddenly they drop will contribute to like how crappy women feel in that premenstrual phase of their cycle. Okay. So going back to fasting during that low hormone phase of our cycle, so during the menstrual phase and maybe a little bit into the follicular phase, typically that is when females will do the best with fasting. So if as a female you wanted to experiment with fasting, that's the time to do it. Okay. Not in the luteal phase, because progesterone, as I mentioned, is the dominant hormone of that phase, and progesterone is a catabolic hormone. So we don't want to be, if we have lots of this catabolic hormone floating around in our body, we don't want to be then putting ourselves in even more catabolic state. And it's not going to do good things for performance, because yes, we do need to like break down muscle for it to grow back stronger, but we don't want to just be like break down and never building back up. Yeah,
not building back up. And so for people that maybe aren't as familiar with the hormones, and of course they're super complex, but so progesterone, how could we maybe characterize that in simple terms and its function?
Progesterones, if we break it down, progestation. So it is the dominant hormone of pregnancy, and its release comes from what's called the corpus luteum. So after females release an egg, after we ovulate, the kind of shell of the egg, I'll describe it, becomes an endocrine organ. It's a temporary endocrine organ, but that is what secretes progesterone. And so if we don't ovulate, we don't make progesterone. We can make a little bit of it from our adrenal glands, and that will happen in postmenopausal women. They're not ovulating anymore, so they rely completely on their adrenal glands to make progesterone. And males have progesterone as well. It comes from their adrenal glands too. Okay. Some from the testes. And then 2, progesterone can be made into cortisol. So again, if we go back to like the stress and sex hormone connection, if cortisol is really high, our body will do what I call the progesterone steal. So it will steal some progesterone to make cortisol, and that just leads to more hormone imbalances, because we need progesterone to balance out the effects of estrogen. So they're both very important hormones. One's not more important than the other, but we definitely want to make sure that we're ovulating, because as I mentioned, that's how we make progesterone. But it's also the dominant hormone of pregnancy.
Okay. Okay. So as far as reasons why you wouldn't want to fast during the luteal phase, so progesterone, just to recap, progesterone is at high, you're in a catabolic state, meaning that your body is kind of eating up its resources, maybe you'd say, and that high progesterone has the possibility of being converted into cortisol at that point?
Yes.
With the added stress of fasting?
Yes.
Okay, and can you maybe explain a little bit why having a high cortisol would be detrimental to someone?
Yeah, lots of reasons. I mean, cortisol isn't a bad hormone. We need it. It does a lot of important things. For one, it's anti-inflammatory, which I'm sure you're familiar with
Yes.
all the patients getting cortisone shots these days.
Right.
But it also is another catabolic hormone, and it's good in small doses. So if we look at, again, going back to the circadian rhythm, we want cortisol to be high in the morning. We want it to spike in the morning. That needs to happen. That's what gets us up, gets us energized for our day. And then we want it to taper slowly throughout the day and be lowest at night. But when it's high all the time, we don't sleep well. We're constantly in this like high anxiety state, so we're never really in rest and digest mode, and a whole slew of issues can come from that. And it's kind of varies person to person. Like some people, when they're really stressed, they get digestive issues. Some women will lose their cycle really easy. Some people have sleep issues. It kind of depends on the person, and there's probably a genetic component to this too, like explaining what we are predisposed to when we're a little bit stressed or a lot stressed.
So people that have a high affinity for anxiety and stress and panic, should they maybe get their cortisol tested, or should they be suspicious at all?
I think we could all use some cortisol management, especially after this past year. Anxiety and depression is like a whole other topic because it's so multifactorial, and I'm sure like having high cortisol is definitely a piece to that puzzle, but there's lots of other things that go along with it.
Right. So kind of adrenal management is just another, facet of dealing with mental health, more or less.
Yes.
Gotcha.
Yeah.
So is there any benefits that you can use to your advantage during the luteal phase when it comes to athletic performance?
I think the biggest thing, I want to emphasize that females can do anything at any point of their cycle. But there are really important things to know, and yes, about the luteal phase, and there is benefits. We have a higher metabolic rate during the luteal phase, so we are burning more calories just at rest.
Right.
Our core temperature goes up. So there's just more considerations. It's a good time to work on technique. It's a good time to do more like endurance things, yoga. You can work out into high intensity, but you need to really prioritize recovery in the luteal phase. It's important for females to prioritize recovery at any point of their cycle. Recovery is a lot different for us compared to males, but especially like even more so in the luteal phase because our metabolic rate is higher because we have more of the catabolic hormone progesterone, and if our hormones are balanced, then it's nice to have a whole month to like change your workouts, and if you have the ability like change what you're doing for work. There's different times of our cycle where we'll probably feel more social, and that's a good time to schedule like talks if you do that as part of your work, or even social events. There's a good time in our cycle to schedule things like goal setting and planning. In the luteal phase, it's a really beneficial time to tie up any loose ends and like finish projects. We just are in this state where we want to like clean our house and like reorganize the closet and like do just finish projects that we started and haven't completed.
Well, yeah, it's really crazy when you consider how much that can actually influence your mindset or your goals or So you're saying really prioritize rest during that phase, and what would that look like objectively? Like what is a measurable, difference between resting during the follicular phase and resting during the luteal phase? How could we present that to our listeners?
Well, based on the research and like there's not as much research as I would like in this, and
it's very specific, isn't it?
It is, and the studies I've read, like some of them are very well done, and some of them aren't, in that we need to confirm ovulation. That's a really important piece. And if research isn't doing that, like, I would not use that study, because when you ovulate, you make progesterone, and that is a completely different hormone profile compared to someone who didn't ovulate. And so the really well done studies will confirm ovulation one way or another, whether that's through basal body temperature tracking, or like using an OPK, an ovulation predictor kit, or actually like doing a blood test of their hormones, or a combination of those.
Right.
So there's a few, I can think of 3 off the top of my head that are quite well done, in that they are using subjects that aren't on any external source of hormones, like no OCP, oral contraceptive, or an IUD, or if they are, they've put those in a different group.
But so you're saying it's very important to like really know when the ovulatory phase is, right, in order to accurately, perform the studies. But also people, for the average person, they're not really capable of measuring or of knowing when exactly that.
Well, they are.
Are they? Well, I don't know.
It doesn't
You're
need
the
to be. It doesn't need to be complicated, and yeah. But you're right. Like a lot of females don't know if they ovulate or not, and they don't know like the simple cues to pay attention to in their body. So I've mentioned basal body temperature. So progesterone will cause a rise in basal body temperature. So that's something I will have my patients do, and is just take, if I want them to track their cycle for whatever reason. I mean, you can give a lot of information about your hormones, but just tracking basal body temperature every morning. It's really easy. Thermometers are like $15. You take your temperature every morning, you record it in a period app, doesn't really matter which one. We just want to record and chart that, so that we can see like your temperature is lower in the first half of your cycle, you ovulate, and then it will rise, and that rise. And it's not always, sometimes you have to kind of see the forest through the trees. So it's not always like textbook low, high. It can be like a gradual increase. But it can tell us how long the luteal phase is, and then that can tell us how much progesterone you're making, because we don't just want to be ovulating, we want to be ovulating well, and make sure that the luteal phase is in fact like 12 to 16 days. That's how long we want it to be. If it's shorter than that, probably have some progesterone deficiency going on there. But that's one thing that females can do. Another thing is tracking cervical fluid. So our cervical fluid will change through the cycle, and it's actually very empowering to know what cervical fluid means, because a lot of females will be like, I get a yeast infection every month. Well, no, you don't. Like, it's just normal. I mean, maybe you do, but, or it could just be normal cervical fluid that your body is meant to produce at certain times of the cycle.
You want to know the difference, though.
You definitely want to know the difference. You don't want to be going to the doctor every month, or like buying an antifungal every month. Like, that's not going to do good things for your body. So that just being educated and knowing like what is normal cervical fluid, and when, like, what should I be looking for? Because when we're ovulating, we will produce quite a lot of cervical fluid usually. It's like slippery, it's like egg white consistency. Hopefully this isn't too much information for you.
I'm all right.
But it's very hospitable to sperm, because our body's like, we want to have a baby, even if you don't want to have a baby, but our body,
sperms do.
Yeah, sperms do. So it makes it allows sperm to like swim very easily. But then at other times when we're not ovulating, our body's like, no, now we don't want to have baby sperm, get out of here. And so it'll be like either dry or like sticky. So again, just like educating females on like what to look for in that regard can help confirm ovulation as well. And then if you wanted to, like the ovulatory predictor kits really are just measuring luteinizing hormone, which is a hormone that will increase before ovulation. But there are some conditions where luteinizing hormone is always elevated. So, for example, polycystic ovarian syndrome, that would, if you were to use an OPK, an ovulatory predictor kit, it would just show that you're ovulating all the time when actually you're not ovulating at all. So that's not the best option. It's one of them, but it can be just like one of the pieces of the puzzle.
But also you'd want to know if you had PCOS, right?
Yeah, there's many other symptoms to PCOS, so that's not.
Hopefully that's not your first, or I mean, hopefully you know by then.
Yeah, it's very common, but like that could be a whole podcast in itself.
Yeah. Okay,
Yeah.
we'll save that one.
Yeah.
Okay, so can there be a lot of variability between these phases? Is that?
Yeah. So our brains can change up to 25% over the course of a monthly cycle. Our brains,
Or
like
your
that's
brains, wow.
that's crazy.
Crazy.
Yeah.
How does your brain change?
Just like you've heard of PET scans, obviously. So like
Yeah.
they've done PET scans on female brains and like have noticed the changes that happen. It's just based on our hormones. So we have estrogen and progesterone receptors in our brain.
Mm-hmm.
So when we're secreting more progesterone, those are going to bind to the receptors and change obviously our moods and our energy levels, lots of different things. Mm-hmm.
Yeah, no kidding. It'll have a lot of effect. Okay. So do you recommend those ovulatory kits to track? You don't, eh? The temperature is more
Temperature
reliable?
is really accurate. Sometimes it's difficult to get patients to remember to take it every single morning because it does we want your basal body temperature. So that's basically your temperature when you're sleeping. So the second you wake up, like before you even open your eyes, just keep your thermometer on your bed stand, stick it under the tongue. It doesn't go anywhere else under the tongue. and it's beneficial if you can get an actual basal body temperature thermometer, which is different than a regular oral thermometer in that it gives 2 numbers after the decimal place. So it's a little bit
Needs to be
more
very exact.
just to see that pattern. So if you're actually charting it, if you only have one number, then it might be more difficult to see the change because the increase in basal body temperature is only like 0.5 to 1 degree Celsius.
Mm-hmm.
So it's not anything crazy, but it confirms that ovulation already happened.
Okay.
So you can't, this is, if you're using this as a contraceptive method, you need to like really know your cycle and do this for several months so that you know actually when you're ovulating because it's before the spike in temperature happens.
Yeah, so probably don't use this as a contraceptive method.
Only if you're in a very committed relationship.
Okay, that's reassuring. Will you put your name on it though? On the record?
No, don't do this. Don't use this as a method of contraception unless you've taken a fertility awareness method. Then you know all the ins and outs of tracking your cycle, and like it's way more detailed than I'm getting into here.
Yeah, so it does take some prioritizing. This is something that someone's gonna have to sit down with and just kind of go through. So let's get back to the advantages of putting the time and effort to kind of track your cycle, and how that can really improve athletics. So just to recap, for the luteal phase, that's a good time if you were trying to maybe cut, like to do endurance type stuff, or no?
No. So if we're getting into like calorie balance, the luteal phase is not the time to be in a caloric deficit. Menstrual follicular, I didn't really talk about like carbohydrate utilization, but our body preferentially burns fat at the first half of our cycle.
Oh, okay.
And so if you wanted to do like a lower carbohydrate diet, the menstrual and follicular phase would be a good time to do that, not in the luteal phase.
Okay. So I'm trying to tease out the real advantage of the luteal phase. Sounds like
it's hard to tease out.
It's hard to tease that one out because it sounds like there's a lot of holdups with the luteal phase.
The poor luteal phase. Well, let's talk about the advantages of the first half of the cycle when estrogen is a dominant hormone. Estrogen is anabolic. So we can utilize that anabolic state. So if we kind of bias our strength training to the first half of the cycle and then use the luteal phase as recovery. So based on the research, they've compared doing strength training, so like 5 days a week in the menstrual, follicular, ovulatory phase, and then 1 day a week in the luteal phase. That resulted in greater strength gains, greater lean mass compared to doing 3 strength workouts the entire cycle. And the opposite, 1 strength workout in the first half, 5 strength workouts in the luteal phase, which is like, that's really interesting, I think. So,
one more.
Did I blow your mind?
It blew my mind. That's one more time, because I got to get... One more time. What was that?
Okay, so it's beneficial to bias strength workouts to the menstrual, follicular, ovulatory phases.
Okay.
Mm-hmm.
Okay,
And
so the first 3 phases.
yes. And this is where, so some research articles will only divide the cycle into 2 phases, and that kind of confuses people, follicular and luteal. But the biggest thing, which I've mentioned several times, is ovulation and knowing when that happens, when you switch from estrogen being the dominant hormone to progesterone being the dominant hormone.
Right.
And it's really important to know if you're going to apply this research, because if you just think like, oh, my cycle is like a textbook and I'm 28 days and I ovulate on day 14, and if you stop strength training so much because you think you're in the luteal phase, and you increase your caloric consumption because you think you're in the luteal phase but you're not, then you might gain weight, or you're just missing the opportunity to build strength.
You're missing that window.
Yeah.
Okay. I'm just gonna introduce to our listeners. We just stepped in. He had an important patient management scenario. Dr. Alex Fitzwich.
Hey guys, how's it going?
Woo woo.
They're doing well. I'll speak for them. All right. So this is a very interesting bit, so I want to make sure I get it right. Mm-hmm. So strength training is optimal in those first 3 phases.
Yes.
And that's because your body is more anabolic.
Yes, it's in a building state. So we're working on building an egg. We are preparing for a baby. Yeah. Even if the baby doesn't happen, then we're still in this like building state, and that's because we have unopposed estrogen. So I mentioned at the beginning that estrogen is also high in the luteal phase, but progesterone is higher, and those ratios are really important. So unopposed estrogen is anabolic.
Okay, so estrogen is anabolic for all our listeners.
Yeah.
Okay, and then testosterone during that phase, is that also?
Testosterone for females is generally low, except ovulation, so it spikes during ovulation, and that can be, so if you're going to go for a PR during ovulation, if you can time it that way, is a really good time to do that.
That's cool. So if there's like 1 day a month, it's like if you can get
but
get your PR on
like
that
I
day.
said before, we can do anything at any point of our cycle. So don't be like, oh darn, my competition isn't on my ovulation day, because that's only 24 hours.
I imagine you could get obsessive about this and be like, oh, I gotta get the schedule
for
all
sure.
right. It's like
that's why
working out alone. It can be,
That's what I want to emphasize. Like, we can do anything at any point of our cycle, so that's good to know, because you don't want to get all like in your head about this, like, oh darn, I'm in my luteal phase during this race. But it's also good to know that your period isn't a hindrance to performance, and actually like that's probably the best time to be competing or training, because our hormones are really low. Obviously, if you are someone who like suffers from cramps or gets really anemic when they're on their period, not ideal, but those problems can be solved. But from a physiological standpoint, when you're on your period, you can perform probably your best.
Really? Perform your best. Wow. And then as that transitions into the follicular phase, is there any kind of distinctions? Any gross distinctions in working out, or is it kind of like strength?
Not really. And it's not like oh, now I'm done my menstrual phase, now I'm in my follicular phase, like now I'm all of a sudden gonna do this. Like it does like ebb and flow from one phase to the other. So things that I'm mentioning, like, oh, this is good for the menstrual phase, this is good for the follicular phase, you can kind of ease into these changes as you kind of like flow through your cycle. Pun intended on that one. But yeah, so that when I mentioned like some research will just divide it into two phases, follicular and luteal, that's because the menstrual, follicular, ovulatory, those can kind of like the hormone profile is fairly similar during that time, so you could just group that into one phase.
Right, yeah, it's a lot to keep track of on its own, right?
It's better when you can see.
All of it, yeah.
Okay, yeah, we gotta get some graphs.
I know. Where's the whiteboard? Let me draw this out.
No kidding.
The pitfalls of a podcast.
Yes. Well, that's very, very interesting. So are there any other hormones that we'd want to talk about that kind of anything else that would follow suit?
I think estrogen and progesterone are the big two for females. We briefly touched on testosterone when we were talking about males a little bit, and obviously females have that too, and that's more of a dominant hormone for males. But I think those are the big ones. Cortisol we talked about. We didn't get into crazy amount of detail there, but we like it, but we also don't like it sometimes.
It's a love-hate thing.
It is.
Yeah, it makes it feel good, but not
I think all the hormones are love-hate. They all have pros and cons, and it's just a big spider web. We need them to all be at the right dial level.
So I feel like estrogen gets a bad rap because high unopposed estrogen can cause a lot of issues that people know about. But
yes,
it's also
estrogen
anabolic.
Dominance, we call that.
Can you tell us a little bit about estrogen dominance?
Estrogen dominance is where your estrogen is higher than your progesterone. And it's not a condition in itself, it's a symptom of other conditions. There's many reasons for estrogen dominance. A lot of it has to do with adiposity. So the more aromatase enzyme you have, the more you're going to convert testosterone into estrogen. So males can have estrogen dominance as well, technically. But yeah, there's a lot of contributing factors to it too. So adiposity is one of them.
And adiposity
if you're not,
for our listeners is?
High, like body fat percentage, lots of fat cells. So fat isn't just sitting there; it's active tissue that's doing things to our hormones. So I mentioned females need to ovulate to produce progesterone, and we need progesterone to balance out the effects of estrogen. So that's a big reason for estrogen dominance in females of reproductive age. When we aren't ovulating, we're not balancing out our estrogen, even if our absolute estrogen levels aren't actually high. So they can be normal levels, but if progesterone's really low, we can still have estrogen dominance symptoms.
Gotcha. And hormones are all kind of relative, right? So they're opposing hormones.
Mm-hmm. And I actually see that quite a bit in athletes, in female athletes. Like athletes aren't always healthy, and especially female athletes, and they're doing whatever their male coaches tell them, not just male coaches, female coaches as well, that are doing their best based on what we've been taught, which is evidence-based, but most of the evidence is on males when it comes to exercise physiology. So I'm glad this area of research is growing. Like there's still a long way to go, but there's lots of important things that female athletes need to know, like doing this exact same thing at every phase of your cycle probably isn't serving you, and you can definitely improve your performance if you change what you're doing at certain times of your cycle, or at least in the luteal phase, really emphasize recovery. And I think that's a big takeaway, because you're not always going to be like, excuse me, coach, I'm in my luteal phase, I can't do 5 strength workouts this week. Like your coach is going to be like, what's a luteal phase?
What does that mean?
So yeah.
Totally.
So, but as an athlete, if you know, like, okay, I need to really prioritize sleep during this time of my cycle, like probably shouldn't be doing crazy social activities at this time, eating enough protein, eating enough carbs, because my body's in a catabolic state, not being in a caloric deficit, not fasting. Those
Right.
things can be really beneficial and just like support the intense training that maybe is being prescribed to the athlete.
For sure. So what are things that female athletes can look out for to maybe tip them off that, hey, maybe I'm dealing with some hormonal imbalances associated with this workout routine?
So just paying attention to your period. It's like a monthly report card, and it can tell you a lot about what's going on with your hormones.
Like the report card is good.
I don't
Yeah.
get one of those.
Yeah, that's why males suck. No, just kidding. No, men don't. But it's not a bad thing. I mean, it's been given this like bad reputation. Like we learn in sex ed class, like you're gonna get a period and it's gonna suck. That's all. That's all we have to tell you.
Have fun for the rest of
Basically
your
how I
life.
learned it.
Yeah, and it doesn't need to be like that, and it can tell us so much information about our health. So if you're, first of all, getting a period every month, like if you're not, red flag, you need to have a period every month. But commonly females will have a period every month, but then are not necessarily ovulating. We call those anovulatory cycles. It's normal to have like 1 or 2 anovulatory cycles a year, but if you're constantly not ovulating, that means you're not making progesterone, and that isn't good. And I talked about how to know if you're ovulating. So the 2 things that I mentioned, so basal body temperature and tracking your cervical fluid. If you want to get really crazy, you can do a measure your cervix. That will change over the course of the cycle. A lot of females are not comfortable with that, and that's fine. It's not necessary. It's just like a triple check.
Triple down.
Pretty
Yeah.
serious check, yeah.
Yeah, and you have to do that like every day.
Every day.
Okay.
Yeah, so monitoring your cervical fluid, because like ovulation is just a 24-hour period of time. Your body will kind of lead up to it. So our cervical fluid is kind of in conjunction to our estrogen levels. So I'll briefly go over it. Hopefully you guys don't get to roast out, but whatever. This is 50% of the population.
We're already in it. You may as well, you know.
Get used to it. Women exist, so.
Yeah. My husband's heard this so many times. He's like, I could probably educate females on their
Stop
hormones.
telling me this.
But this is how it should go. I mean, every female is a little bit different, but the first week of your cycle, first 5 to 7 days, you're bleeding. Obviously, that one's easy to know. And then you'll go through a bit of like a dry phase. You're not really producing any cervical fluid. And then as estrogen starts to build, you'll excrete some. It's kind of like sticky, maybe white, like lotion. And then
This is during the follicular phase.
That's during the follicular phase, yeah. And then it will become more like lubricative as ovulation approaches, because your body's like, ooh, it's almost go time. We want to make a baby. We need to have this fluid that's really hospitable to sperm. We want the sperm to come up into the uterus and go into the fallopian tubes and hopefully connect with an egg. So that's the body's goal. So it starts to excrete this really fertile cervical fluid. For some women, it's a lot of volume, and this is what I was mentioning. Like, some women think they get an infection every month, and it's not. Their body's doing what it's meant to do. Sometimes like you don't even have to check. You can just like, it just feels like slippery down there. But you can, like, and I educate my like female patients, or I run a hormone performance course, and I educate those participants on how to like actually track cervical fluid, and you can like look at it in your hands, like get really in tune with your body.
The stretch test.
The stretch test, so it should.
Stretches.
It's really stretchy. So the listeners obviously can't see what I'm doing with my hands.
Tapping
right now,
2 fingers together.
Yeah, index finger and thumb, and you should be able to stretch it at least 2 inches. But when it's really fertile, you can stretch it really far, and that's you are about to ovulate. You may not be ovulating in that moment, but you're going to ovulate. And since sperm can live up to 5 days in utero, you're fertile. So like, don't.
So watch out.
Yeah.
Do it. We'll do it. Hey, for our listeners, so you instruct a course. Sorry, what is that called?
It's called the Hormone Performance Connection.
Nice.
Guess what it's about?
Performance connections with hormones. Shot in the dark there. All right, and if they're interested in attending this seminar or course?
Yeah, it's a 12-week course. I've ran it twice now, and I'm going to run it again in September. So the end of September, we're going to launch it again. It's very educational. So the first 4 weeks of the course is all about like going into way more detail about what we talked about today. So how to track your cycle, how to like read your period, I guess, and know when there are hormone imbalances and what they might be, which is really helpful when like you're working with your doctor. Like, I think this might be going on, and then you do a blood test and see for sure. We talk a little bit about common conditions. So I mentioned PCOS briefly. That one's super, super common in all females, but especially female athletes, and a few other ones. And then we get into a lot of nutrition. We get into supplementation and injury prevention. So as you guys are familiar with, like, females are way more prone to ACL tears. There's different reasons for that. There is a hormone component to it as well. Obviously, like our hip, the Q angle, the hip to knee angle. So we talk about that stuff, like different warm-ups you can do to prevent injuries from happening. When in your cycle you're more prone to those injuries happening. We talk about like heat acclimation, like different things that females need to know versus males, recovery. So we go into a lot of detail. Some of it's pretty sciencey. I mean, I'm saying we because I run it with one of my colleagues who is a naturopathic doctor in Edmonton. But that's the gist of it. So end of September, it will be launching again.
You know, if I was a reproductive female, I feel like this would be the most relevant course you could attend. I mean, this totally applicable.
Yeah, we've gotten really good feedback from the 2 times that we've ran it. So.
Yeah, it's very cool to just understand what's going on with your body.
And it's cool for males to understand what's going on for females and why we're different sometimes.
That explains it. Okay.
Everything's making sense, right?
Gotta take the 12-week course.
Yeah.
Yeah. Well, I might have to. Wow, very interesting stuff. So, you know, we talked about a lot today. A lot of, you know, things kind of blew my mind today. So I want to go back to quickly do a recap of these advantages that we might find at these 4 different phases in menstruation. So first one, menstrual, you were saying.
Yeah, so the menstrual phase is a good time to be in a caloric deficit. So if you're trying to cut, dieting at that time is okay. Don't do more than like 500 calories. Bad things will happen to your hormones if you do. Maximum 500, ideally like 250.
Deficit, so your normal calorie intake is?
Yeah.
Okay.
And strength training, really beneficial. So again, this is like different female to female. The first 1 or 2 days of your period, you might feel lower energy because we're losing iron. But still, based on the research, estrogen your hormones are pretty low at that time. But as estrogen starts to build, we want to focus on strength training. You'll typically feel stronger at that time. And then as we move into ovulation, some women feel really energetic and like very social at that time. Good time to go for a PR, as I mentioned. Yeah. Some women, and I would say this is a lower percentage, they feel really tired when they ovulate. Really? So again, that's just like getting to know your body. I
just want to like maybe draw a connection that isn't there, but people feel very social during that time. Maybe they're trying to meet a mate.
Exactly.
High estrogen level, yeah. Skin is shiny, like all that stuff.
Yeah,
mucus is slippery.
That's right. You're ready to go.
Yeah, slip and slide.
Don't need to use lube at that time of your cycle.
That's good. You save on lube too.
Yeah.
Cool, and then...
And then the luteal phase, really, it's beneficial to focus a lot on recovery. I mean, I didn't go into a lot of detail about recovery, but in general, it's different for males than females. But important to not skip out on it in the luteal phase. Ideal to not strength train every single day, because just because we're in a catabolic state doesn't mean we can't do it. It just means we need to make sure we're doing all the other things.
So as opposed to strength training, what would be a better supplementary training?
Cardio, technique work. Like it's a good time to have a deload week. The luteal phase is the longest phase, but it's also different. Like we can break it down into like early luteal, mid luteal, and late luteal. The late luteal phase is when that would be a good time to do a deload week. That's when the hormones are going from this high state to the lowest they're going to be in the cycle.
And that's when
That's the
typically females
premenstrual.
kind of feel it.
Yeah,
feel that.
so like premenstrual syndrome, that's when that will happen.
Yeah. Okay. Cool. And then some other, just another note we kind of touched on. Be kind of wary if you're fasting. If you're a female fasting or intermittent fasting, you may want to be kind of cautious about that. Is that correct?
Yeah. Mm-hmm. Yeah. Not that you can't do it, but if you're gonna do it in the menstrual and follicular phases.
Okay, cool. So it sounds like there's a whole lot of advantages to being familiar with your phases and kind of exploring that side of your anatomy of your body.
Physiology.
Endocrinology.
Yeah.
There you go.
Mm-hmm.
Wow, especially if you're athletic and you really want to capitalize on that.
Exactly.
Wow.
Mm-hmm.
Women are so elaborate.
I know.
Could you imagine if we were like that, man? We wouldn't get away with it.
I'm okay with being a simple
Yeah.
Yes.
person. All right, well, thanks, Dr. Mandy Swinden, for coming on the show.
Oh, you're welcome.
And, really appreciate everything. This was great. Found it super interesting.
Yeah, super interesting.
And we'll have to have you on again.
Okay.
I'm sure we can do that.
Okay.
All right.
Pencil me in.
And thanks for tuning in. Once again, we are Move to Improve. We've rebranded. It's a better name. Hope you enjoyed the podcast.